Welcome to the training videos from Medi Orthopedics. The following film will give you helpful tips about using the Medi Arm Fix immobilization orthosis. The Medi Arm Fix can be used after surgery on either the left or right shoulder. In post-operative use, the Medi Arm Fix is put on while the patient is still in the operating theatre in order to avoid harmful movements of the operated shoulder during repositioning. This procedure is possible in both the lateral and supine positions. Thanks to the universal size, no prior measuring is required. Please ensure that the two arm loops are not yet attached to the waist belt. These will be positioned individually at a later point in time. First of all, open the waist belt. If the left shoulder has been operated on, as in this example, the shoulder strap should lie on the side with the sewn-in label. In the case of surgery to the right shoulder, just pull the shoulder strap on the back of the waist belt over to the other side. Now grasp the end of the waist belt with the Velcro fastener and pass the strap from behind underneath the patient. Close the strap laterally below the chest. In order to avoid harmful movements of the patient's operated shoulder when opening the waist belt, please ensure that the Velcro fastener is located on the same side as the affected shoulder. Now position the large forearm loop centrally on the waist belt. The black fastener points towards the patient's head. Secure the affected forearm using the Velcro fastener. The patient's hand remains outside the loop. Secure the smaller loop laterally to the waist belt and close the Velcro fastener around the upper arm. It is important to place the upper arm loop next to the fastener of the waist belt so that you can still open the waist belt. The loop should be positioned at the upper edge of the waist belt so that it does not later rub uncomfortably in the crook of the arm. The upper arm and forearm are now secured against the body, approximately at right angles to each other. Place the thin strap over the uninjured shoulder and attach it at the front buckle. Adjust the shoulder strap length using the Velcro fastener so that the affected arm is supported and firmly secured against the body. Please ensure that the shoulder padding is lying on the collarbone and that the chosen length of the shoulder strap allows the patient to sit up at a later stage. Once the Medi Arm Fix has been correctly adjusted, the patient can also don the product independently. When putting on the product, open all the straps. Carefully secure the end without the Velcro fastener below the affected shoulder between the elbow and the upper body and close the waist belt again below the chest. Please ensure that the Velcro fastener of the waist belt is positioned on the same side as the affected shoulder. This prevents you from accidentally opening the waist belt using the arm on the same side as the operated shoulder. The shoulder strap is placed over the uninjured shoulder and attached to the waist belt. Check in the mirror that the Medi Arm Fix is positioned correctly. Talk to your doctor or orthopedic technician about when and for how long you should wear the orthosis. You can wash the orthosis in cold water and mild soap suds and allow it to air dry. In order to prevent adhesion of the joint structures due to the immobilization, careful pendulum exercises are recommended. To perform these exercises, open the forearm loop and make careful swinging pendulum movements. During your further treatment, you can also open the upper arm loop while exercising. Always talk to your doctor beforehand about the type and duration of exercises that are appropriate for your individual situation. We wish you a speedy recovery. Medi, I feel better.